Hi, I'm Dr. Christian Allard, Doctor of Chiropractic. And if you're watching this video, it's probably because you're suffering from back pain and it's not going away. You might have tried home remedies like ice, heat, stretches, massage. You might have tried other form of therapies like physiotherapy, chiropractic, acupuncture, medication, and it's you're still suffering. So in this video, I'll actually go through step by step on how we manage to get 85 to 90% results, even with the hardest cases. So I'll go through the former therapies, but also how we actually combine those therapies to get the best results possible. Now, if you're not suffering from back pain, you can actually save yourself some time. You can leave this video, but you can always watch it if you want. So the first step is to get a good history taking or medical history. So this is quite regular in chiropractic or in medicine in itself. So we need to know when the problem first started, not necessarily when the pain first started, but we actually see a lot of people that have had problems like 15, 10, 10, 15 years ago, and then the problem comes back. So that is really important. We need to figure out as well what makes it worse, what makes it better, which kind of form of therapy you've tried before, have you had surgery and all that. So we need to know all those things. The second step is the examination. So in the examination, we do a series of tests. And between the examination and the history taking, this is where we get most of the diagnosis. So we do orthopedic tests, neurological tests. We do palpation. So if you want to know what palpation is we press on the areas and we need to recreate the pain that you're actually suffering with. So if we can recreate the pain, then we know that we're like right on target on that area. And then we actually have x-rays, we actually have ultrasounds, or if you need an MRI, we don't have MRI on site, but you can also have an MRI and then we can actually have a look through it. But once we actually have the results of the test and also the imaging, we need to create the diagnosis. And the diagnosis is very important because a lot of people don't understand exactly where pain actually comes from. So especially people from the public, they've never had back pain, but it's really important to realize that it could be coming from different type of tissues. And what do I mean by that? You could have pain coming from your discs. So that is excruciating pain. Could have pain coming from your joints, like the posterior joints in the spine, for example, or the sacroiliac joint. You could have pain coming from the fascia or the muscles. The fascia is the layer that surrounds the muscles. Or you could have pain from the ligaments. Now, the pain from ligaments is probably the least or the most undiagnosed conditions that we actually see. I'll go through the video in a minute. So we do prolotherapy for that. We tighten the muscles, and it works extremely, extremely well. From the therapies that we actually do, we actually have non-invasive therapies. So those are physical therapies, and we also have a little bit more invasive therapies, which are injection therapies. So on the non-invasive, we have what we call shockwave, or it's a percussion therapy. So what it does, it breaks down scar tissue. It actually hits the scar tissue, creates some blood flow. It actually loosens up the spine, loosens up the muscles. It creates flexibility, and obviously, ultimately, it decreases the pain. So that's pretty much like one of our most, common treatment that we actually do. The second treatment that we actually do as well, which works really, really well for disc injuries, is spinal decompression. So the term spinal decompression speaks for itself. So if your spine has been crushed or you've lifted something too heavy or you fell on your bum, and then the discs are compressed, then that could actually be extremely painful. So spinal decompression is one of the best form of therapy for that. So it'll actually stretch the disc, and especially if the disc is bulged and pressing on the nerves, then the disc will start to actually resorb itself. The pressure will reduce to the disc, and eventually the pain will start to subside. Other form of therapies that we actually also use is radio frequency. So radio frequency uses it's an electrical power that actually goes through your body. So we use there's a return plate, so and we have cream with electrodes, and it goes through the body, and it increases blood flow, increases speed of healing, and so on, decreases inflammation. Same thing with laser. So laser is really efficient for that as well. So spinal compression, a radio frequency and laser actually helps in the speed of healing. Some people struggle to actually heal. So those form of therapies are very, very, very useful. Now, a lot of people come to see us and they've tried, like we've tried Shockwave, they've tried IDD or spinal compression in other places. So, in order to bridge the gap between surgery and non-surgical treatment, we actually do a lot of injections. So, those injections are regenerative medical techniques. So, we use three main techniques. We use prolotherapy, we use prolozone, and we use hydrodissection as well. Now, let me break it down for you what it actually means. So, for example, prolotherapy will actually go directly on the ligaments or between the junction of the ligament and the bones. Now, most people don't realize that, but ligaments will actually have a lot of blood flow until the age of 16. And between the age of 16 and 25, that blood flow will start to reduce. And eventually, ligaments don't have any more blood flow. So if you injure a ligament, and ligaments hold the bones together, by the way, and if you injure those ligaments, there's a lot of nerve receptors in the ligaments. And if the ligaments are not corrected or healed properly, they will build scar tissue. They'll be very painful. And every form of therapy you'll actually try will actually fail, unfortunately. So that's when prolotherapy comes into play. Now, prolotherapy has been existing for several years. It is an injection of glucose. So we use typically 15% glucose, and it's an injection between the ligament and the bone in itself. And what it does, it starts to recreate that blood vessels or that blood flow that goes into the ligaments in order to actually heal the ligaments or recover, or you can call it tissue reorganization, whatever you want to call it. And basically, it gets the ligament to start to be flexible, starts to actually make sure that ligament is nice and strong, and ultimately it reduces the pain. Now, prolozone is a different technique, and prolozone uses ozone, which is O3. So, for example, in knees, it works really well. We can use prolozone, so we use ozone into the knee joint, for example, and as we actually do that, it feeds the synovial fluid. It actually creates oxygen, and oxygen is life, as we all know. So it actually helps people heal from those problems. We can use it in the back as well, in the muscles and so on. So we can use it in different areas. Now, the last form of injection therapy that we actually use is hydrodissection. So how does hydrodissection actually works? Now, it actually works really well for fascia, but it also works well for muscles. Now, just imagine the muscles are like all layers on top of each other. And let's say, for example, you injure yourself. Between the layers, that's when you actually have blood vessels that actually bring the food and also the oxygen to the tissue so that you can contract your muscles and it's nice and strong. But if you actually injure your muscles, the muscles, all the layers will start to actually crush one against another. And then the blood vessels won't actually be able to circulate as well. Now, two things, because the blood vessels don't circulate as well, the muscle will become weaker, but also you will have scar tissue between those layers and it'll start to be like really, really stiff. And nerve endings, which are almost everywhere in our body except our hair and nails, will start to send the pain signal from the muscle all the way to your brain, and then you will feel pain. So with hydrodissection, we go between those layers and we free that up with what we call 5% dextrose water. And then we free that up. It works extremely well. And especially if shockwave or massage has actually failed, we find that we get excellent results with that. Now, one of the things that's really important is you must give yourself time. So that pain or that problem that actually has taken hold in your body has actually done it through a period of time. So you must give yourself, some time to actually get it healed or get it treated. So for example, if we look at injection therapy, so we do anywhere between 3 to 6 treatments, and they're anywhere between 3 to 4 weeks apart. If somebody undergoes, for example, spinal compression, so treatments varies, protocol varies between 12 to 24 treatments. So we tend to actually recommend 12 visits. That actually works quite well for most of our patients. If patients have shockwave therapy, for example, we usually prescribe anywhere between 12 to 24, but it's over 12 is over a period of 6 weeks, so it's 2 visits a week. Nevertheless, whatever you need in terms of treatment, the most important thing is that you get better. And unfortunately, not everybody gets better, but if you do not get better, is to be able to say that you've ticked the boxes, you've tried everything, and then you go for a surgery or something that's going to be most invasive. So if you are interested to actually come in for an assessment or an examination, please contact us. It'll be our pleasure to actually welcome you and see if we can help you to have a better life and a better quality of life. Thank you.